The U.S. Department of Health and Human Services is on a mission to do more with less after firing some 20,000 workers across the federal agency, eliminating entire departments.
The Office of Child Care, which distributes child care funding to states, is among those feeling the cuts. Ryan Wooten has more on what this could mean for Maine.
We have two goals. The first is obvious, to save the taxpayer money by making our department more efficient. And the second is to radically improve our quality of service.
Just 4 days after notifying the public that the U.S. Department of Health and Human Services would be cutting roughly 20,000 employees, letters of reduction in force were sent to thousands of federal workers. Employees from the Administration for Children and Families Office of Child Care, agencies within HHS weren't spared.
So some folks were, already on their way to work.
At 5:20 a.m. Tuesday, some workers who oversee state systems that monitor health and safety standards for child care facilities were placed on administrative leave and informed that they would be fully relieved of their duties on June 2nd. Those workers also distribute Child Care and Development, or CCDF, funds, helping nearly 1 million families afford child care every month.
We were told that, they're effective immediately and we would have no access to the building.
5 out of 10 regional OCC offices were completely gutted. The regional office in Boston, which serves families in New England and works closely with Maine, is now shut down. Swift decision-making from the Trump administration leaves former OCC director, who was appointed under the Biden administration, wondering how widespread closures will impact families who rely on child care assistance funds.
At the moment, the actual dollars for the program have not been cut. But if the people aren't there to administrate it, it can't run well. If it doesn't run well, children will be in less safe childcare. Childcare will become more expensive for families, and it will become even harder for families to find.
Child care professionals say care can be $300 weekly for children ages 3 and up, and even more for babies and infants. Child care assistance subsidies distributed to states by the OCC reduce those costs drastically.
For families who rely on that funding, how do you tell them that the funding that they receive that ensures their children are able to access affordable child care may be at risk?
I've got one family that pays $1. There's other families, depending on their situation, where their weekly fees are, like you said, $60 or $70. And I think everybody's been budgeting and having that be their norm. And so the thought of things increasing will be pretty catastrophic for families trying to make ends meet.
In Portland, Ryan Wooten, News Center, Maine.